Welcome back to Talk to Doc. I'm Maricel Laksa Pangilinan with Dr. Oyi Balburias.
Of course, still joining us is Ms. Dina Bonnevie, who is a patient partner of the Medical City's Center for Wellness and Aesthetics.
Well, we usually have a guest doctor to talk to us about a specific health condition. But today is special as my doctor partner here is our resource person. That's because Doc Oyi heads the Center for Wellness and Aesthetics of Medical City, and he led a multidisciplinary team of experts who guided Ms. D to her present state of wellness.
Yes.
Naku, mga questions ko ngayon sa inyong dalawa. Okay, so Doc, how does your team define wellness?
Well, for us, wellness is a decision on the part of the person to pursue healthy lifestyle.
Tama si Doc, it's a decision because if you don't decide to be healthy and to be in a state of wellness, kahit na anong gawin ng doktor, nothing's gonna happen.
Did you
Nothing's gonna
feel
help
that
you.
na parang after a while going through all these stressful times with your heart, with your mind, with your body, na parang, hey, I need to decide na this has got to stop.
Actually,
Diba?
I really made a decision there because, I mean, you know me, I've always been like, you know, concerned about wellness even before. But that was like my awakening. It was like an epiphany for me. Because when Doc asked me, are there other things that bother you aside from your schedule and your late nights? We need to know because sometimes, you know, some diseases or some disease are caused by, you know, your unwellness or unhealthiness in spirit and in emotions. Kung sabi ko, naku, Doc, I'm going through a tough time, ganyan. Okay, these are the things you have to let go. You know, you have to decide, do you want to continue this lifestyle? Do you want to go towards that lifestyle? What do you still want to do in your life? So
Yes.
parang I said,
Pinayo mo dun, Doc.
I only saw one apo, I'm still waiting to see another one.
No, like what we in wellness kasi we analyze and evaluate patients as a whole. No, of course, many people think that our health is just physical. So we say that it's beyond that. So it encompasses mental, emotional health, social, environmental, and even to some patients even spiritual. No? So we consider that, and so we'll be able to help the patient or the person as a whole. No? So hindi pwedeng ito lang. So
I remember when Doc Oye asked me that. Sabi ko, Doc, excuse me, I'm just wondering, you know, there's too many questions being asked. I mean, this is the first time I had to answer a ton of questionnaires
yes.
to get well. I mean, what's the whole thing? And then he said, well, because it's not a one-size-fits-all.
Yes.
That's
You know,
good.
your wellness walk in the Wellness and Aesthetic Center is something that will be tailor-made for you. Your ethnicity, which is, I'm partly European, Swiss, my mother's Swiss. So, and then your build, di ba? May mga mesomorph, may endomorph. And then of course you have your lifestyle. And then emotionally, what are you going through? Kasi minsan marami kang you're feeling a lot of things in your body which aren't really there, but it's, you know, psychosomatic, parang psychological. So that's when I understood. And of course, he knew that I was going through a lot because I was going in and out of Medical City already at that time. And he said, since you're always here in our hospital, would you like to join the
So they
wellness
found you and you found them.
In a way.
Yeah, actually, na-hospital ako doon.
Ay.
And then, that was when all of a sudden my right side just numbed. Then I was rushed there early in the morning. And then I didn't want to be confined, so I stayed in Danica's house, which was just a stone's throw away from Medical City. It was in Valle Verde. And then after that, I said, it's really weird, you know, I feel like something's going up. I want to go back to the hospital. Take me there. And then they did an MRI and all the scans and everything, and they didn't see any
Anything.
sign of a stroke. So they said maybe it's the whiplash, maybe it's the neck, it's spondylosis and all these things, or maybe it was a transischemic attack. But nevertheless, the point was there was something wrong.
Yeah.
Because she really has many complaints. Like she was feeling a lot of things. Okay, so like she's heartburn, everything. She cannot understand anymore what's happening to her, and she knows there's something wrong, and she just wants answers. Okay, so I said it's not going to be a short thing that I can already say everything in one sitting. So I have to evaluate you, analyze you, and everything about you. So it starts with answering a very comprehensive questionnaires. No? So these questionnaires evaluates the person as a whole, like I've said a while ago. And from there, we sometimes we even meet as a team in order to assess the individual. So from there, we design, first we detect or screen for something possible that is really a physical manifestation of an illness. Then once we analyze that, we try to evaluate also the mental health, emotional, and everything. So that's how it goes.
So, hindi ibig sabihin like she wants something done that you're actually gonna do it just because
No.
she wants it.
No.
It has to be a team effort.
Yes, and sometimes even we patients would even like mind it if I say things about their lifestyle. Of course, it's very difficult to convince a person if you're dealing with their behavior, with their choices, with their mindset. No, so it's easier if they feel something, if they know that there's something wrong with them. But sometimes if they don't feel anything, but you evaluate or you see that there's a lot of lifestyle risk factors to develop a certain disease, then you have to be proactive about it. Then we have to tell it to the patient that, you know what, smoking is not very good for you. You may not be feeling right now anything, but later on, that will translate into something
Actually,
else.
a good example of that was when he asked me to have a test for the, what was that? When they put the thing inside my throat.
Uh-huh.
A very, very long...
What's that called, Doc?
Laryngoscopy.
Yeah, and I
Laryngoscopy.
said,
Ayaw mo.
of
Ayaw
course,
niya.
I said, of course, when I got to the hospital, okay, we're going to put this inside. I said, what? I said, what is this? It looks like a snake. I said, you're going to put it inside my throat? So I said, can I talk to Doc Balburias? Eh, makulit akong patient eh. So he was saying, grabe, you know, this patient asks a lot of
questions.
questions.
Kaya nga.
So siguro pinagpapawisan na siya, parang grabe naman itong pasyente. Ang daming tanong. Because
Importante.
I'm a wellness person. That's my advocacy even before. So talagang binilabalasa ko siya. Why do I need this? Well, because you're complaining, you know, that you have a hoarse voice and
Chronic
you know,
coughing.
you're coughing in the morning. And so in-explain niya na maybe you have like acid reflux, ganyan. So doon ko naintindihan. Siyempre, nung una, when I first saw him, sabi ko, what? Dr. Bato or artista? But when he started talking and telling me, no, it's like this, like that, like that, and then, until I ran out of questions. Kasi, he didn't leave any stone unturned eh. Everything he would answer, and I really kept on asking.
Well,
So when I get
yeah.
there, parang, alam niya na, parang, naku, she's gonna ask na naman.
Hindi, pero
Another set of
actually,
questions.
mabuti nga yun kasi yung ibang patients, kung ano lang sabihin ng doktor, gagawin nila, pero kulang yung evaluation.
No, me, I really asked.
Oo.
And then I asked pa, bakit yung ibang test hindi sa akin binigay? You don't need it.
Yeah.
That's good. Because
You don't
know
need it. Why are you going to pay for
Yeah,
tests you don't
that's true.
need?
There are other units in the wellness center, di ba? What are they?
Well, the center is divided into 3 sections for wellness. So we have adults, geriatrics, no, for those 60 years old and above, and then the adolescent wellness center or the teen health hub. So different age groups with different health concerns, we manage them, of course, or approach them differently as well. And of course, we are also an aesthetic center. So we have board-certified plastic
Oh, yun,
surgeons.
importante yun.
So who can perform, because, well, you've said about the philosophy of wellness. In Miss D's case, we were able to come up with wellness is the new beauty. Because in her, she's not just pretty, she's also good inside. No? So like, she feels good, she looks good. No?
I mean, I've been with wellness people for quite some time in my life now. But I've also met some people who would like suggest things to be done or procedures to be done without any due analysis or study,
Evaluation,
or
yeah.
evaluation. They would just say like this, like that. You know, that's the quick way. And I've seen actresses go through the same thing, and then after a while, parang, why is she so fat? Kasi hindi nga wellness yun. Those are quick fixes. Iba yung your body's evaluated, your blood type, everything, your diet.
Oh, you evaluate them very well, and I saw that the wellness really looks great, the interiors. Pero
Yeah.
we'll talk more about that. We'll be taking a break right now. Stay with us because Doc Oyi and Miss D will answer the questions from our studio audience and televiewers as well. We'll be right back.